Hello Atlanta Nation, it's been a while since I posted. Thank you so much for all your comments. I've loved the interactions we've had on Atlanta Nation, and it's been an amazing last few months with new updates to Invisalign, the Invisalign Summit, and I'm really happy to be back on this platform teaching you guys tips in the video format. This little video I want to tell you guys about is about refinements, and it's December, it's the end of the year, it's the busiest time in the Invisalign world. Everyone's trying to get their submissions in before the 6-month period's over to lock in their tier rankings and their discounts for January 1st. And Invisalign techs in Costa Rica are completely bogged down. There's more case submissions in December, refinements than ever before. Things get a little slower. And when dealing with refinements, it can really hurt your practice and your profitability, especially if you have multiple refinements in cases. This time of the year, if it takes a week to get back a refinement and get it sent out, your patients are going to get upset. It's going to hurt your practice. Certainly, they're not helping your production and profitability. This is the time it matters most. I want to talk to you guys about taking control of your refinements. First thing I want to talk about is the difference between a refinement and a revision. A revision is something where you mess up on a plan and you've got to go back and change the plan. I use the analogy of a snail race with orthodontics all the time. So you start on the path, something doesn't work, you have to change the plan to adopt. You got to pick the snail back off because it gets off track, it's starting to head away from the finish line. You got to pick it up and put it back, change your plan. Revisions are bad. That means you made mistakes. Now they're not something that doesn't happen. I still have lots of revisions in my practice. I learn all the time from them, but you have to make sure you learn from your revisions. Now, refinement is one where you don't change your end goal. You keep it the same. You just tweak it a little bit to perfect it. Now, refinement's easy to fix, but if you submit a case to Invisalign and the case comes back from Invisalign and it's got attachments all over and the case is longer than the original ClinCheck, what I mean by that is you have an original ClinCheck, original case has 20 aligners. Patient comes in, a few teeth aren't where they want to be, and you submit it, it comes back, and now it's 30 aligners, tons of attachments, and they're doing all kinds of things and shifts. That's a total misstep. It's bad for Invisalign, it's bad for your practice. You don't want to accept those, so you got to control them. I'm going to show you guys a case that came through our group, and this is a ClinCheck that was submitted back in September 2018. I'm looking at the ClinCheck. There are some things that were done inefficiently. I'm looking at the photos of this case. Basically, implant space, trying to intrude a super erupted molar here and close some space. There's a major food trap there. Teeth are retroclined back. Certainly, these spaces are there for a reason. This patient should have never been a patient where we have overcorrection aligners, never been a patient where we're trying to close all the spaces and retrocline teeth even more. But here we are. We submitted this case out. It was a mistake. It needs a revision. However, we send this case back for treatment planning. I go to the treatment timeline. I look at treatment plan number 3, which is the one that came back from Invisalign after rescanning and revising. I download this one, and I'll show you what it looks like. It looks like it's going to take a lot longer than I want to fix it. 5 aligners, more retroclining, root torquing, lingual retorquing. The space is still there. It's really not doing what I want it to do. So how do we take control of this? One way to do it is you manually go in, create a modification, right-click, lock teeth, and start correcting it from there. In my case, what I did is I just typed in the comments. I just said, let's see, where is it? Please send back with no adjustments, no attachments, no movements. I'll manually modify. Also, leave on existing attachments. Thank you. This is what it looks like now. So the doctor who submitted this case took off all the attachments after the refinement. You'll see these are just 3 passive aligners. Invisalign sent this back. Pretty easy to modify. We still have the space here, 0.7 millimeters. There's a implant in that site now. Let's see, was that the one with the space in it? Yeah, so this doctor put an implant in there midway through, but there's still spaces and problems with the alignment. I'm going to create a modification, and I'm going to correct this case the right way. Now, there's a couple of key pieces here. One, this is not a case we want to overclose, overcorrect, bring teeth back. You look at the photos from the before case, these teeth want to be spread out. This would be an ideal case for a cosmetic restorative combination where we're bonding to lateral incisors, or we leave space distal to canines called primate space. Now, my experience, primate spaces need to be 0.5 to 0.8 millimeters. If they're less than that, they're massive food traps. I like to exaggerate them a little bit. I want to close down that massive food trap there. And then all I'm going to do is manually go in here and put teeth in the right place. Close down all these spaces. And then I'm just going to rotate. I like this hinge movement. This has been a really nice addition to ClinCheck Pro. I'm going to rotate these teeth into a better position. I'm going to expand the arch, procline. You got to kind of play this game, and when you do one little movement, sometimes the ClinCheck will do another movement on another tooth. That's just the way the algorithm works. It usually works in your benefit, but sometimes you have to go and undo it. And you'll see I just start clicking around, moving the teeth into a better position. Now, by leaving the space distal to the canines, I don't have to retrocline or overcorrect these teeth. Get a lot of expansion there on that right side, maybe a little bit too much. Let's see. Yeah, I don't want to expand that much. Certainly need to bring this one back. Let's see now. Much better. So, in some occlusal interferences here, got to go in here and manually delete the extrusions, vertical movements. And it looks like I still need to procline the anterior segment because I'm hitting on the anterior. When you have red spots on teeth, the instinct is to intrude them, but really sometimes all you have to do is expand. That one's an implant, so you want to make it unmovable. That tooth I actually have to intrude. A tooth that's next to an implant that's not moving has a lot of anchorage. Let's see these lower incisors, pretty simple. Do I want to do more IPR on the lower arch to close these spaces? You know, I don't. I'd rather procline the anterior more. So I'm just going to procline these teeth until I see no more red spots on them. But that means that you have to increase that primate space. So we're going from in to proclined out. Still not much proclined out. I'm actually going to keep going. Let's do 2 millimeters of primate space. Now, the bigger the primate space over 0.5 millimeters, the more cleansable it will be. Let's see if we can get this. There we go. Make unmovable. Make unmovable. Let's see on this side. You want to remove all these spaces here. Now it's hard to follow all this, but if you understand all these clicks and how I'm doing this manually, you can do this on your own. You take control of it. When I send this back to ClinCheck, it's going to have fewer aligners. I always, in the comments, I type in, please add 3 passive aligners at the end. And that's all I'm commenting. Very simple instructions for the text. Not much to follow. Now this ClinCheck is going to come back in 2 days. for me to accept. It's not going to hurt my production in the month of December. It's not going to hurt Invisalign with all their, techs taking all their attention on new cases, and I can continue to boost production in my office. Now this is it. Look, very few vertical movements in this case. A couple extrusions here, which, with no attachments on. Certainly don't want to do extrusions. That's a hard movement with no attachments. Look at the arch before and after. I'm just expanding it out. This arch is begging to be expanded out. You look at the photos from when the patient started. There is not minimally attached gingiva here. These teeth want to be proclined out. They're retroclined. They're crowded. And now we're doing that. We're expanding these teeth out. And that's it, guys. I mean, this case took me about 10 minutes to do. That's normal. But now the techs aren't going to have it in their hands too long, and I get it back quick, and I can submit it for aligner production. Thank you, guys. Have a good night.